What are burns? Burns are one of the most common household injuries, especially among children. The term burn means more than the burning sensation associated with this injury. Burns are characterized by severe skin damage that causes the affected skin cells to die. Most people can recover from burns without serious health consequences, depending on the cause and degree of injury. More serious burns require immediate emergency medical care to prevent complications and death. There are three primary types of burns: first, second, and third degree. Each degree is based on the severity of damage to the skin, with first degree being the most minor and third degree being the most dangerous. Well, the first degree burns include red, non-blistered skin. The second degree, blisters and some thickening of the skin. And the third degree burns include widespread thickness with a white leathery appearance. There are also fourth degree burns. This type of burns includes all of the symptoms of the third degree burns and also extends beyond the skin into tendons and bones. Burns have a variety of causes including scalding from hot boiling liquids, chemical burns, electrical burns, fires including flames from matches, candles and lighters, excessive sun exposure. The type of burn is not based on the cause of it. Scalding, for example, can cause all three burns depending on how hot the liquid is and how long it stays in contact with the skin. Chemical and electrical burns warrant immediate medical attention because they can affect the inside of the body, even if skin damage is minor. First degree burn cause minimal skin damage. They are also called superficial burns because they affect the outermost layer of the skin. Signs of the first degree burns include redness, minor inflammation, pain, dry peeling skin occurs as the burn heals. The second degree burn are more serious because the damage extends beyond the top layer of skin. This type burn causes the skin to blister and become extremely red and sore. As with first degree burns, avoid cotton balls and questionable home remedies. Treatments for a mild second degree burn generally include running the skin under cool water for 15 minutes or longer, taking over-the-counter pain medication, applying antibiotics cream to blisters. The third degree burn, excluding 4 degrees burns, are the most severe. They cause the most damage extending through every layer of skin. Depending on the cause, the symptoms of third degree burns can include waxy and white color, char, dark brown color, raised and leathery texture, blisters that don't develop. Without surgery, these wounds heal with severe scarring and contracture. There is no set timeline for complete spontaneous healing for third degree burns. Well, that's all for this video. What is a concussion? A concussion is a mild traumatic brain injury. It can occur after an impact to your head or after a whiplash-type injury that causes your head and brain to shake quickly back and forth. A concussion results in an altered mental state that may include becoming unconscious. Anyone can become injured during a fall, car accident, or any other daily activity. If you participate in impact sports such as football or boxing, you have an increased risk of getting a concussion. Concussions are usually not life-threatening, but they can cause serious symptoms that require medical treatment. A concussion is different from a contusion. A concussion especially affects your brain, but contusions are bruises. Contusions can occur on your head, but they are not typically serious and tend to resolve within several days. Symptoms of a concussion vary depending on both the severity of the injury and the person injured. It's not true that a loss of concussionist always occurs with a concussion. Some people do experience a loss of concussionist, but others don't. The symptoms include memory problems, confusion, dizziness, double vision, headache, nausea or vomiting, sensitivity to light or noise, balance problems, slowed reaction to stimuli. The symptoms might begin immediately, or they may not develop for hours, days, weeks, or even months following your injury. During the recovery period after a concussion, you may experience the following symptoms: irritability, sensitivity to light or noise, problems with concentration, and headaches. Signs of concussion in a loved one. In some cases, a friend or loved one might be having concussion, and they don't know it. The following are some of the signs to look out for: problem with balance, problems walking, loss of coordination, irritability, unequal pupil size, an inability to wake up, also called a coma, vomiting, lasting confusion, and more. How a concussion is treated. Treatment for a concussion depends on the severity of your symptoms. You might need surgery or other medical treatments. However, most concussions don't require surgery or any major medical treatment. If the concussion is causing headaches, your doctor may recommend over-the-counter pain relievers such as ibuprofen or another. Other complications include post-concussion syndrome, which causes you to experience concussion symptoms for weeks or even months instead of just a few days. Post-traumatic headaches, which may last for a few months. Post-traumatic vertigo or dizziness that lasts for up to several months. Brain injuries from multiple problems. How prevent concussions? You can reduce your risk of getting a concussion by wearing the correct helmet and other athletics safety gear during sport activities. Always make sure the helmet and other gear fit properly and are worn in very well way. Well, that's all for this video. Constipation. Chronic constipation is infrequent bowel movements or difficult passage of stools that persist for several weeks or longer. Constipation is generally described as having fewer than 3 bowel movements a week. Though occasional constipation is very common, some people experience chronic constipation that can interfere with their ability to go about their daily tasks. Chronic constipation may also cause people to strain excessively in order to have a bowel movement. Treatment for chronic constipation depends in part on the underlying cause. However, in some cases, a cause is never found. Signs and symptoms of chronic constipation include passing fewer than 3 stools a week, having lumpy or hard stools, straining to have bowel movements, feeling as though there's a blockage in your rectum that prevents bowel movements, feeling as though you can't completely empty the stool from your rectum, needing help to empty your rectum, such as using your hands to press on your abdomen and using a finger to remove a stool from your rectum. What causes constipation? The most commonly causes occur when waste or stool move too slowly through the digestive tract or cannot be eliminated effectively from the rectum, which may cause the stool to become hard and dry. Chronic constipation has many possible causes. Blockage in colon or rectum include tiny tears in the skin around the anus, narrowing of the colon, rectal cancer, colon cancer, and more. The risk factors. Factors that may increase your risk of chronic constipation include being an older adult, being a woman, being dehydrated, eating a diet that's low in fiber, getting little or no physical activity, taking certain medications, include sedatives or some antidepressants or medication to lower blood pressure, having a mental health condition such as depression or an eating disorder. Complications. Complications of chronic constipation include swollen veins in your anus, torn skin in your anus, a stool that cannot be expelled, intestine that protrudes from the anus. Prevention. The following can help you avoid developing chronic constipation. Include plenty of higher fiber foods in your diet, including beans, vegetables, fruits, whole grains, cereals, and grain. Eat fewer foods with low amounts of fiber, such as processed foods and dairy and meat products. Drink plenty of fluids. Try to manage stress. Do not ignore the urge to pass stool. Try to create a regular schedule for bowel movements, especially after a meal. Make sure children who begin to eat solid foods get plenty of fiber in their diet. Food corns are hardened layers of skin that developed from your skin's response to friction and pressure. You might have food corns if you experience the following symptoms, like rough, taut, yellowing patch of lumpy or bumpy skin, a skin that's sensitive to touch, pain when wearing shoes. These symptoms occur in your toes. Where do foot corns develop? Corns can form in variety of places on your feet, such as below your toenail bed, between your toes, on the sides of your feet, on the bottoms of your feet. What causes foot corns? You can develop foot corns from wearing shoes that are too snug on your feet. If you stand or walk for long periods of time, the weight of your body and the constant friction can also cause painful corns on the bottoms of your feet. How can you treat foot corns? If you are sure you have a corn, you can try one of these methods to manage it at home. You should also get rid of any shoes that are too small for your feet and other ill-fitting shoes. File away the corn. It might be possible to remove the corn using these steps. Soak your feet in a warm bath with Epsom salts. After the soak, pat your feet dry with a clean towel and moisturize with hydrating lotion or cocoa butter. Continue this process daily until your corn has softened. After it's softened and not painful, try gently rubbing the corn with a pumice stone. If the corn is between your toes, use an emery board, also known as a nail file, to rub them. Repeat these steps until your corn has disappeared, which may take a few weeks. How prevent foot corns? The best way to prevent corns from forming or returning is to make sure you wear comfortable shoes that fit your feet properly. Your toes should be able to move easily in them. If you are breaking in shoes, wear socks that are thick over your toes. You can also cover the tops of your toes and sides of your feet with reasonable bandage where they are prone to corns. Finally, keep your toenails trimmed, as long toenails can cause your toes to be in an abnormal position. What can you expect long term? Corns won't disappear overnight, but you can see lessening appearance in as little as 2 weeks with treatment. It may be a month or more before they completely disappear. If you regularly develop corns, look for more supportive, comfortable shoes. Feet can change size over time, and shoe size can vary between different manufacturers. You may need to switch to a larger size or purchase shoes that are made for wider feet. A shoe store associate should be able to measure your feet and help you find properly fitting shoes. Coughing is your body's way of getting rid of an irritant. When something irritates your throat or airway, your nervous system sends an alert to your brain. Your brain responds by telling the muscles in your chest and abdomen to contract and expel a burst of air. A cough is an important defensive reflex that helps protect your body from irritants like mucus, smoke, and allergens such as pollen, dust, or mold. Coughing is a symptom of many illnesses and conditions. Sometimes the characteristics of your cough can give you a clue to its cause. For example, for behavior or experience, when and why does the cough happen? Is it a night after eating while exercise? I don't know. Characteristics. You can describe your cough, but its characteristics. How does your cough sound or feel? Hacking, wet, dry? For the duration, does your cough last less than 2 weeks, 6 weeks, more than 8 weeks? Effects. Does your cough cause related symptoms such as urinary incontinence, vomiting, or sleeplessness? Occasionally, your cough reflex is triggered by an obstruction in your airway. If you or your child has ingested something that could be blocking the airway, seek immediate medical attention. Signs of choking include bluish skin, loss of consciousness, inability to speak or cry, whistling or other odd breathing noises, weak or ineffective cough, panic. What is the wet cough? A wet cough, also called a productive cough, typically brings up mucus. Wet coughs are commonly caused by a cold or the flu. They can come on slowly or quickly and may be accompanied by other symptoms such as runny nose, postnasal drip, fatigue. Remedies for this illness: in babies and very small children, treat with a cold mist humidifier. You can also use saline drops in nasal passage, then clean the nose with a valve syringe. In children, a small clinical trial found that 2 teaspoons of honey given a half hour before bedtime reduce cough and encourage better sleep in children aged 1 and older. In adults, can treat acute wet coughs with OTC coughs and cold symptoms, relieving medication or honey. What is the dry cough? A dry cough is a cough that doesn't bring up mucus. It may feel like you have a tickle in the back of your throat, triggering your cough reflex, giving you hacking coughs. These illnesses are often difficult to control and may present in long fits. Occurs because there's inflammation or irritation in your respiratory tract, but no excess mucus to coat up. Dry coughs are often caused by upper respiratory infections, such as a cold or the flu, in both children and adults. It's common for dry coughs to linger for several weeks after a cold or flu has passed. Other possible causes of dry cough include laryngitis, asthma, allergies, and others. A disease is a particular abnormal condition that negatively affects the structure or function of part or all of an organism, and that is not due to any external injury. Diseases are often constructed as medical conditions that are associated with specific symptoms and signs. A disease may be caused by external factors such as pathogens or by internal dysfunctions. For example, internal dysfunctions of the immune system can produce a variety of different diseases, including various forms of immunodeficiency, hypersensitivity, allergies, and other disorders. In humans, disease is often used more broadly to refer to any condition that causes pain, dysfunction, distress, social problems, or death to the person afflicted, or similar problems for those in contact with the person. In this broader sense, it sometimes includes injuries, disabilities, disorders, syndromes, infections, isolated symptoms, deviant behaviors, and atypical variation of structure and function. While in other contexts and for other purposes, these may be considered different categories. Diseases can affect people not only physically, but also mentally, as contracting and living with a disease can alter the affected person's perspective on life. Death due to disease is called death by natural causes. There are four main types of disease: infectious disease, deficient disease, hereditary disease, including both genetic disease and non-genetic hereditary disease, and physiological disease. Disease can also be classified in other ways, such as communicable versus non-communicable diseases. The deadliest diseases in humans are coronary artery disease, followed by cerebrovascular disease and lower respiratory infections. In developed countries, the diseases that cause the most sickness overall are neuropsychiatric conditions such as depression and anxiety. The study of disease is called pathology, which includes the study of etiology or causes. The causes. Only some causes, such as influenza, are contagious and are commonly believed infections. The microorganisms that cause this disease are known as pathogens and include variety of bacteria, viruses, protozoa, and fungi. Infectious disease can be transmitted by hand-to-mouth contact with infectious materials or surface, by bites or insects or other carriers of the disease, and from contaminated water or food. Also, there are sexually transmitted diseases. In some cases, microorganisms that are not readily spread from person to person play a role, while other diseases can be prevented or ameliorated with appropriate nutrition or other lifestyle changes. Type of causes. Airborne. An airborne disease is any disease that is caused by pathogens and transmitted through the air. Foodborne is any illness resulting from the consumption of food contaminated with pathogenic bacteria, toxins, virus, or parasites. Infections. Also lifestyle. A lifestyle disease is any disease that appears to increase in frequency as countries become more industrialized and people live longer, especially if the risk factors include behavioral choices like sedentary lifestyle or a diet high in healthful foods such as refined carbohydrates or alcohol. Epidemic is the rapid spread of infectious disease to a large number of people in a given population within a short period of time, usually 2 weeks or less. For example, if an attack rate in excess of 15 cases per 100,000 people for 2 consecutive weeks is considered an epidemic. Epidemics or infectious diseases are generally caused by several factors, including a change in the ecology of the host population, a genetic change in the pathogen's reservoir, or the introduction of an emerging pathogen to a host population. Generally, an epidemic occurs when host immunity to either an established pathogen or newly emerging novel pathogen is suddenly reduced below that found in the endemic equilibrium and transmission threshold is exceeded. An epidemic might be restricted to a one localization. However, if it spreads to other countries or continents and affects a substantial number of people, it may be termed a pandemic. The declaration of an epidemic usually requires a good understanding of a baseline rate of incidence. Epidemics for certain diseases, such as influenza, are defined as research as reaching some definite increase in incidence above this baseline. A few cases of a very rare disease may be classified as an epidemic. There are several changes that may occur in an infectious agent that may trigger an epidemic. These include increased virulence, introduction into a novel setting, change in host susceptibility to the infectious agent. An epidemic disease is not required to be contagious, and the term has been applied to a West Nile fever and obesity epidemic. There are two types of epidemic. Common source outbreak. In a common source outbreak epidemic, the affected individuals had an exposure to a common agent. If the exposure is a singular and all of the affected individuals developed the disease over a single exposure and incubation courses, it can be termed a point source outbreak. If the exposure was continuous or variable, it can be termed a continuous outbreak or intermittent outbreak, respectively. Propagate outbreak is the second type. This disease spreads person to person. Affected individuals may become independent reservoirs, leading to further exposures. Many epidemics will have characteristics of both common sources and propagate outbreaks. For example, secondary person-to-person spread may occur affect a common source exposure, or an environmental vectors may spread a zoonotic disease agent. Transmission. Airborne transmission, arthropod transmission, biological transmission, colostral transmission for the contact, developmental transmission, fecal-oral transmission, horizontal transmission, that means lateral spread to others in the same group and at the same time spread to contemporaries, the mechanical transmission, the propagative transmission, vertical transmission, from one generation to the next. Well, that's all for this video.